If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. All right. Am I live? Are we live? I think we're live. Okay, let's try this again. Technology. We're going to woosah right now, right? Because we are going to get this information out to you today about coronavirus. So if you're just tuning in again, thank you for your patience. Thank you for staying on with me. I am Dr. Donna. This is Talking with Dr. Donna. This is my first live show. I have two excellent guests, Dr. Jocelyn Freeman Garrick and Tammie Lee. So I'm going to reintroduce them because I want to make sure you understand who they are. I'm going to reintroduce myself. And this is Talking with Dr. Donna. So this is a platform that I created to bring you education, information, and resources that are pertinent and relevant to you and your life. I want you to live your best life, mentally healthy, spiritually healthy, and physically healthy. So I will be bringing you lots of shows, lots of information that will hopefully help you and your families. Today is my very first live show, like I've mentioned, and I wanted to bring on these great women who are so busy, and I so appreciate them taking their time today to be with us to talk about this important topic of coronavirus, testing for coronavirus, why it's important to test, looking at masks, why it's important for us to wear masks during this time, and then the data, because that's important to know the numbers and the statistics. So my two guests today, my first guest is Dr. Jocelyn Freeman Garrick, who is an ED physician at Highland Hospital. So she's my colleague in that way. She is also the director of coronavirus testing for Alameda County, which is why she is the perfect person to have on the show today. She's also the disaster director for Alameda Health System and the deputy medical director for emergency services for Alameda County. She's also the founder of Mentoring in Medicine, which is a program that takes students of color from middle school, high school, and college who are interested in a career in health and brings them along and gives them mentoring that they need in order to become where she and I are today. She's also the mother of three brilliant, beautiful Black boys and lives here in Oakland. So thank you, Dr. Jocelyn, for being with us today.
Thank you for having me. I appreciate you giving us this platform, the fabulous, esteemed Dr. Donna.
Thank you. All right. And then we also have on our show today, Tammie Lee. So Tammie is a community epidemiologist, and a number of you asked me what that means. So I'm going to let Tammie explain what that means. But she is the community epidemiologist for Alameda County Public Health Department. She's also the data lead for the health equity team of Alameda County, and she's a national leader for Robert Wood Johnson Foundation Culture of Health Equity. And she's a mother of two as well. Hi, Tammie. Thanks for joining me.
Hi, I'm so glad to join you today, Dr. Donna.
All right. So let's start with first, you tell us what an epidemiologist is and what you do and why it's important for you to have the position and job that you have.
Yes, I am a community epidemiologist, and that means I have the important job of monitoring health in communities and then taking those data, those numbers, and helping to use them for action. So we can use data to speak truth to the kinds of conditions, the kinds of things we're seeing out there in communities, and to really seek to meet the needs.
Awesome. Thank you, Tammie. All right, let's get into it because we have even shorter period of time due to the technical difficulties, and I don't want to use up the time that our guests have devoted to us. I want to make sure you get this information. I am going to do my best to monitor your questions on YouTube. However, if we don't get to your questions, just continue to put them in the comment section, and then I will get back with you the answer to those questions from either Tammie or from Dr. Jocelyn, okay? So again, today we're talking about coronavirus. I know you have all heard about coronavirus for the past several months. You're probably tired of hearing about coronavirus, but guess what? It's going to be with us for a while. So while we're here, let's get the information and the knowledge that we need to make the best decisions for ourselves and our families and our coworkers and everyone else around us. As you know, coronavirus is called novel coronavirus or COVID-19, and that's because it's new. It's a part of a family of viruses that was known to us. That's like the common cold is a part of the coronavirus family. But coronavirus, this new COVID-19 or SARS-2-CoV, however you want to call it, is a new virus to us, which is why there was when we first were introduced to the virus, there were a lot of mixed messages, a lot of, okay, we should do this. No, now we should do that, because this was a new virus. And as we've gotten more information about the virus, we've become better at how to prevent the spread of the virus, how to test for the virus, and looking at the numbers of the virus. So without any further ado, I want to talk with Dr. Jocelyn, who, like I mentioned, is the Director of Testing for Alameda County. And I want to ask you, Dr. Jocelyn, why is it important for us to get tested?
Okay, Dr. Donna. Well, if we understand the prevalence and incidence of the disease, so how many people have it and how many new cases we're getting, it helps us gather the data that Tammie and her team is evaluating, so we know how to keep people safe. For example, hopefully most of your listeners know that the Governor Newsom's been on the TV a lot. He releases these indicators that will determine if we could move to the next phase of sheltering in place. One of those indicators is testing, actually the first one. And for our county, they want us to test 3,100 people a day. You know, why do we have to test 3,000 people a day? Because it gives us a sample idea of how many people actually have the disease. And if those people know they have the disease and they can isolate and quarantine and prevent further spread of the disease. So that's one reason that we want to test. We also just want to test because some people, frankly, especially in Black and brown people, they may have the disease and not know the infection, and then they wait to go to the hospital potentially because they don't initially have symptoms. And then when they get symptomatic or they have an extreme presentation of the disease, it's harder for them to recover fully quicker. So we want to diagnose it early and we want to diagnose it to protect their immediate family, friends, co-workers, and the general public. For our Black and brown audience, they should know, and Tammie can go more into detail, we have 8 community testing sites in Alameda County for those of your audience who are in our county. And that doesn't include if you have Kaiser or you are a vet, if you have Blue Shield, you can go to your private insurer to get tested. But if you have barriers or you can go to any of the free community sites, anyone, and get tested. And our testing criteria now, as of Monday, so hot off the press, you don't have to have symptoms, you don't have to be over the age of 65, anyone can get tested. And the reason for that is because our data is showing that more than 50% of the people who test positive have no symptoms. So you can just have it and not know. We found that a lot of people going back to work, maybe their jobs required it, and they were just getting it just to get the paper, to get clearance. But most of our positives were in that population who did not have symptoms. We also want to demystify that our young people are getting it. If you go to our Alameda County Public Health Department website, it shows you by age who is getting COVID-19 from 0 to 17, 18 to 30. And the 18 to 30 bracket is the highest percentage. Tammie can correct me, but they're like 20 to 25%. If you conglomerate 18 to 50, those between 18 to 49, more than 50% of our cases are in that age range. So that's the younger, healthier, working, likely essential workers out in the community, young people maybe hanging out, socializing, no symptoms, because more than half of them have no symptoms. So we envision the young, healthy person or your teenage granddaughter working at In-N-Out who has it because she's interfacing with so many people, comes home. There are multiple generations in the home. Grandma's in the home, mom is in the home, or dad. And then you give it to grandma, who waits, baby, I'm fine. I don't need to go to the hospital right now. And then grandma doesn't go to the hospital until she is short of breath and really weak. And then we have complications, because the data also shows that Blacks are dying at a higher rate with COVID when we get COVID. So it is imperative, especially in the Black and brown and parts of the Asian community where the numbers are ticking up, that we just get tested. Please just get tested.
Yes, thank you, Dr. Jocelyn. That's great words of wisdom. I hope people are listening, because I do hear a lot of people who are in that younger age group that say, well, I'm not sick. I'm not going to get sick. And there is a difference between being asymptomatic and being pre-symptomatic. And I talked about this in one of my videos last week, that the difference, you can't tell the difference between someone who tests positive that is asymptomatic versus someone who is pre-symptomatic, which means that they're not sick today, but
right.
They are going to get sick. And at the time that they take their test and they're positive, you can't tell those people apart. So
right.
It's really important then to know whether or not you're positive, and that is why there's testing. So I wanted to make sure you also heard Dr. Jocelyn say that you can get information about where to get a free test. If you go to the website of Alameda County Public Health Department, and I believe you look under testing, is that the tab? And it will give you a testing site where you can go. And just like Dr. Jocelyn just said, there are no criteria any longer. Anyone can get a test, okay? So Tammie, let's talk a little bit about the data and the numbers and what you're seeing from the data.
So the real deal is that there are over 5,000 cases in Alameda County. And about 1 out of 3 of those cases are among young folks, less than 30. If we look within our Black and brown communities, it's about half of our African Americans that are under age 50, and about 80% of our Latinx cases that are people less than 50. And so we know it's our elders in our communities that are dying, but our young folks are getting infected, and they're getting hospitalized. About 1 out of 3 of the people who are hospitalized are less than 50. Wow. And so, because Dr. Donna, you talked about how COVID's novel, it's new. Every time we think we know something about COVID, we learn a little something different. Now we're seeing that almost half of the cases, you don't know if you have COVID. You're asymptomatic or pre-symptomatic. And so it's really important that people go out and get tested so that we know our status.
Right, great.
And you just hit on an important point, Dr. Donna, with being the novel corona. You know, when this disease infection first came out, everyone was talking about fever, cough, shortness of breath. And then my peers in New York were saying, I have a lot of people coming in with diarrhea and abdominal pain. And then we realized that was another presentation. At our facility, I had a gentleman come in with just a rapid heart rate and weakness, and he tested positive. So we still are learning. We don't understand. So for the audience, well, I'm not coughing, I don't have difficulty breathing. It may not present that way. It's still a new infection that we're learning. They're showing that the largest indicator from the data we have right now is loss of taste and smell. Most people with symptoms say, my taste buds change and I'm having problems smelling, and maybe just some weakness. I feel like I'm dragging. I don't have enough energy. Or as Tammie said, nothing. You may have no symptoms, but still be a carrier who can spread it. So thank you.
Yes. So I want to talk a little bit about the test itself, because even that has been evolving from the beginning when we were first testing to where we are now. There's lots of different tests out there, lots of different ways to test. And so can you talk a little bit, Dr. Jocelyn, about the various tests? Is it the front of the nose, the mid of the nose, the back of the nose, the throat?
Yes.
There's so many different ways to test. Can you talk a little bit about maybe these tests and what tests are we doing here in Alameda County?
Sure. So there are probably 4 or 5 methods to get tested. There's the nasopharyngeal or NP, back of the nose, the long Q-tip. That's the brain scratcher.
Way back here.
I had that brings tears to your eyes.
Yes.
And take that and rotate it for about 20 seconds. So everyone on, in your audience can tolerate it. It is uncomfortable, but it is over in less than 30 seconds.
Yes.
Initially, most of the facilities across the country were using that one because that is the one that was validated to have. If you have COVID, it would test positive 99% of the time. And if you didn't have COVID, it would test negative 98% of the time. Over the last few months, they have validated and confirmed other methods that are just as good as that, with 95% sensitivity and specificity. And sensitivity is just, if you have it, you really test positive. The test shows you have it, and if you don't, the test is really negative. But your audience knows with any test, there are always mistakes. So 3 to 5% of the test could be an error or indeterminate. But the mid-turbinate, which is a shorter Q-tip, it just has to go to the mid part of your nose, is an option at multiple sites. Then the anterior nares is just really literally going in the tip of your nose where your kids tend to pick their boogers. You say, get your finger out. It's really just going right there. And it's often a self swab. So now, like at West Oakland Health Center and at Allen Temple Baptist Church, you can take the Q-tip, and Allen Temple has the patient themselves stick it in their nose to the mid part. At West Oakland, you take it and you just put it in the tip, rotate, and then you put it in the tip of the other nostril and rotate. So those tests are easier, and you can do them yourself, the anterior nare and the mid-turbinate. Then there is the saliva, as you mentioned, or the oral swabs. I don't know of any testing centers in Alameda County that is doing that yet, but I do know those are coming. We have 2 vendors that are considering using those because now their sensitivity and specificity are just as good. So you just want to ensure if you get a test, it's actually going to give you the accurate result by whatever means that you think you're comfortable with and appropriate. If you're like, I don't want to do that swab myself, I'm not comfortable, all of the centers, even if it's self-administered, they have medical professionals there who will do it for you. So if you're not comfortable, then they'll help you get the test done in real time.
Awesome. That's great. Thank you, Dr. Jocelyn. So many of you might have seen the video when I went to get my testing done, and I did the one way in the back of the nose at the first. And so it is tolerable. It's not comfortable, but you can do it for sure. So let's talk a little bit about masking, okay? About the importance of wearing a mask or a facial covering. So we talked about testing, and that's important. It's an indicator for us to say whether or not we can open up and kind of release some of our shelter in place orders. And we also talked about testing being important because it's good for you to know if you have the disease, even if you're asymptomatic or pre-symptomatic, because then you can spread the disease to others. So now you have this test result, it's positive. So, but you're asymptomatic, right? So, and you need to live out in the community. You need to walk around, you may need to go to work. One of the ways in which we are now instituting and have been for a while to help prevent the spread of the disease for those who are testing positive is wearing a mask or a facial covering. I think that it's important for people to understand that nothing is 100% foolproof to help prevent the spread of this virus, as we know, but everything that we do helps to decrease the risk. Testing is a part of that. I did a survey on Facebook earlier this week, and I asked a couple of questions. And one of the questions I asked was, are you concerned about whether or not you have coronavirus? And another question was, have you been tested? And over almost 60% of the people who responded to the survey said that they were concerned that they might have coronavirus, but only 20% have received a test. So if you're concerned, then you need to get tested. Everyone should be tested for coronavirus, as we all are living out here in this community. Masking is important. Why is masking, facial covering, how does that work, Dr. Jocelyn, to help decrease the spread? And why is it so important for everyone to wear a facial covering when they're outside of the home?
Yeah, I'm happy to try to address that. I will say, if you test positive for corona, you obviously should be wearing a mask, but you should, by our health officer orders, isolate yourself at home. The health officer orders say that if you test positive, stay home for at least 10 days after you first become ill or test positive, and then 3 days if you have symptoms until you have recovered. So you should isolate and not go to work, not go to school, not be in public areas for at least 10 days if you test positive. The literature for the mask, just for the general public who doesn't have COVID or who don't know they have COVID, has shown that wearing a face covering, like the nice ones that a lot of people have been making themselves, or that you can purchase, the cloth face coverings, they found reduced transmission by more than 50%. The surgical masks that maybe you and I have, or that people can purchase, have been found to reduce transmission by like 65%. And the N95s that are primarily used in the hospital or clinic setting, because you're worried about air under pressure with someone who has COVID, have been found to reduce the transmission close to 80 to 85% just with that mask. When you couple that with hand hygiene and distancing, so if you have a cloth face covering and you're doing hand hygiene by gelling, using a hand sanitizer or washing your hands after touching something, and you're keeping your distance, they found that it's close to 85 to 90%, you can prevent the transmission. So that's 9 out of 10 times, even if you were exposed to COVID, you would not get it, which is huge. The face coverings, if you have it and you don't know, prevent you from transmitting it potentially and protect yourself. So it's just kind to our citizens and your fellow neighbors and family members to wear it, because some people do have a lot of fear when they see someone walking down the street. Our health officer orders now say it's mandatory in the state of California when you are out in a public place to have it. If you're trying to exercise, jog, walk with your family, you should have the mask. If you see someone within 30 feet of you, they ask that you slide it up. So once they get within 6 feet, everyone has their mask on. The masks are preventing the transmission. And again, most of us don't know we have it, because more than half the people, and Tammie can go more into detail, but it's like 50 to 80%. Up to 80% of people are asymptomatic. By the last state guidelines, 75% of those tested had no symptoms, but they were positive. So we have to wear our masks to prevent transmission.
All right, great. Thank you, Dr. Jocelyn. Tammie, do you want to add anything in terms of what you're seeing with the data?
I would say that there is essential places that we have to go. There are people who need to go out and get their dialysis treatment. There are workers that need to go and ensure that we have food on our tables, that we have goods that we need to access from our stores, that our kids are taken care of if we're essential workers. And because so many people have to go out and work, or in the current context, people have to go out and protest, to make their voices heard, to stand up, to be there for their community. And we can do those essential activities if we mask, if we keep our distance. There is essential things that we still have to do, but what is also essential is that we mask and protect ourselves, protect our families, protect our communities.
Amen.
Right. Yes, thank you, Tammie. Tammie, I want to go back to you with some of the data just really quickly, because I think we mentioned it earlier about who is impacted. And I know some people have heard that the Latinx community has the highest rate of infection, but the African-American community actually are sicker. Can you just kind of talk about that data and maybe break it down for us about exactly what does that mean?
Yes, that is all true. So over half of our cases are in our Latinx community. And part of that is because of the fact that many of them are our frontline workers. Many of them are living in multi-generational households, busy taking care of their families. So the risks are higher. The risks of exposure are higher. And then, in addition to the risk of getting sick, the risks of getting hospitalized and of dying from COVID are higher for our Black and Brown communities, because about 44% of those who are getting hospitalized with COVID are Latinx, while Latinx people only represent 22% of people in our county. For African Americans, we know African Americans are about 10% of our population, but they represent 17% of those folks who are ending up hospitalized with COVID, and almost more than 20% of our deaths from COVID. And so the case fatality rates are highest for African Americans, even though they're not getting infected at the same rates as Latinx, for example.
And do you have any thoughts about why that is? Like, what do you think is going on with that data when you see African Americans, 10% of the population, but almost 20% of the deaths from the disease? What, as the data guru, what do you think about that? What are your thoughts?
Yeah, I would say, as a community epidemiologist, unfortunately, this is not a new pattern of racial health inequities that we're seeing in our county. And the pattern that we're seeing is deeply rooted in history, in place, in racism, in differences in income, and where you live and your opportunities for health. Just to be clear, our case rates for COVID are nearly 7 times higher in our very high poverty neighborhoods than in our most affluent communities in Alameda County. And so what that means is that our communities that have been under-resourced, that have been disinvested, that continue to face institutional, structural racism in healthcare and beyond, what that means is that then it shows up in the times of pandemics. So those risks that already put our communities of color at increased risk are amplified in the context of a pandemic like COVID. And so COVID is the crisis, and so is institutional structural racism, and it plays out in this context. And it also means that we have to utilize our data to advocate for ourselves, to get resources where they're needed, to go out and get tested, and to mask and protect our families and communities.
Great, thank you. Dr. Jocelyn, do you have anything you want to add to that statement?
No, I agree with everything our guru is saying. I think that methods like this to reach our community in a culturally relatable way and to say things where they understand. Dude, you can have it, you just don't know. And now you're gonna give it to your grandma. Like, we need young people involved in the messaging and communication. We need everyone in your audience to become an advocate, to make a commitment that they educate their own family. And then the poverty issues, because the reality is, if you are poor and you are Black and brown or Southeast Asian, you're not going to do as well. Everyone, COVID is impacting everyone, but our data is showing it's impacted more the poor, vulnerable communities. So we have to be advocates and reach that community effectively in a way that they understand, to demystify some of the beliefs in our communities.
Right. And I think it's so important, because I know that you can attest to this, Dr. Jocelyn, that you probably get this in the emergency room. I get it all of the time when I'm working, that so many people of color, once they see me come into the room, will reveal to me things that they have not revealed to doctors that they may have seen yesterday, the day before, the week before. And so the cultural competence
Every day.
Every day, right? Cultural competence of the providers is important. It's also important for you as to advocate for yourself. You have to be able to say, I feel sick and I'm not going to leave until you help me. And if you're not going to help me, let me speak to, the charge nurse, or let me speak to the supervisor, let me speak to someone. But you have to advocate for yourself. It's really difficult during this time, because when you're sick, and if you're sick, there's no one else that can come into the hospital with you, right? Because of the visitor restrictions that we've put in place because of coronavirus. And that's why it's important not to wait that late. Don't wait until you can't advocate for yourself because you're so sick. You've got to come in. And I know that there's a lot of mistrust of the healthcare, the health community, and it is not unwarranted. But there are providers out there who understand, who know, and who are willing to help you. So you have to come and see us, and you can't wait until the last minute to be seen, because as you're hearing from this data, the longer you wait, the sicker you're going to get, and the harder it will be to treat and beat this disease.
The only thing I would add to that,
yes.
Donna, pardon me for interrupting you, and Tammie can elaborate. Tammie and I would implore your audience to encourage everyone to get tested. She mentioned that 9 to 10% of all COVID cases in our county, and even lower in the state, are in Black, and more than 50% in brown. But we set up testing sites in communities that are predominantly Black and brown, like Allen Temple, like Roots Community Health on 99th and East 14th in Oakland, like West Oakland Health Center in the heart of West Oakland. And less than 20% of the utilizers of those sites are Black. About 25 to 30% of the utilizers are brown. So it's available in the communities that we believe Black and brown people would be comfortable. La Clinica in the heart of Fruitvale, that site is doing much better with our Latinx population, but our Black people aren't getting tested in the amount we would want, considering how much we're dying if we get it. So we need to utilize the sites and get tested.
All right, Tammie, you have something else?
That Jocelyn mentioned that this is one of our indicators. So we're gonna open up at the pace that folks are getting tested to the levels that are adequate, and to the extent that we know that people can safely isolate and quarantine. And the problem is that if our high impacted communities are not getting tested, then we're gonna make decisions too fast, without knowing if our Black and brown communities and some of our other hard hit communities are really safe. The only way that I, as an epidemiologist, can know how our communities are doing is if I can see that the folks who should be getting tested are getting tested, the positives are showing up, and the positives are being able to isolate and quarantine.
All right. So you're hearing that, everyone. It's important to get tested. Lots of sites, if you go to the website for Alameda County Public Health Department, and I know there's lots of people who watch me, thankfully, that are outside of Alameda County, but I'm sure if you go to your public health department's website in whatever county you live in, that information is available to you about where you can get tested. The one thing that I myself haven't actually been telling folks, so thank you, Dr. Jocelyn, is that if you do test positive, that you quarantine yourself. So even if you are asymptomatic, and again, that is because just when you test positive, we don't know which category to put you in, as asymptomatic or pre-symptomatic, meaning in the next 2 to 14 days, you might develop symptoms, and then you are even at a higher risk of spreading the virus to those that you love. So if you test positive, you should quarantine for how many days again, Dr. Jocelyn?
10. And I know that is really hard for some families if you have one bathroom in the house, or if you have to isolate yourself to a bedroom, which is the challenge when you have multiple generations, or even one, just an immediate family in a home. So I also mentioned acphd.org is the county website. They also have resources for housing. If you feel like you cannot isolate appropriately because you just have too many people that have to use the same kitchen and they can't bring you your food to your room, then there are hotel options for those who are positive and cannot isolate, which you can also find on the Public Health Department's website.
Awesome. And I'm sure that that's for every county, not just Alameda County, the number of places of resources that you can get for housing, for food resources, for just testing locations, where to get a mask if you haven't created a mask. And I think it's important also to do a face covering, even if it's not a mask. I know I keep saying mask. I'm trying to teach myself to say face covering, because it's not just a mask, but any covering over your face, we know decreases the risk of transmission of the virus to someone else. So it's important that we have a face covering. Okay, so we're winding down, and I just want to give Dr. Jocelyn and Tammie an opportunity to make any final statements, final plugs, information that you think is important that we didn't get an opportunity to pull out while we were chatting. So I'll start with you, Dr. Jocelyn.
I just want to thank you. I can't think of anything else right now. I'm sure when we end, I'll think of something and I can email you or text you. But I appreciate you being a community advocate and a leader to ensure that our community stays healthy. So thank you for doing what you do.
Thank you. All right, Tammie.
And I'll just underscore that anyone can get COVID. But the impacts that we're seeing are uneven in our county and in other places across the country. And so now is the time to really seek to protect our friends, our family, our coworkers, our communities, and go out and get tested, wear a mask, keep your distance, and stay strong.
Yeah.
We're all in. It's all of us. It's all of us. So together, we can make it through this marathon of the pandemic.
I think that's the only thing I'll add, Dr. Donna. We were noticing in the emergency department, it's a really stressful time in the world with our leadership and our national government, with the protests and COVID and sheltering and not being able to hug a friend or a coworker. And we started seeing people present with somatic symptoms or but stress-related symptoms, tension, headaches, leading to migraines or gastrointestinal, stomach upset, abdominal pain, that the root cause was stress and just a mental exhaustion from what's going on in the world. And a lot of people have become unemployed and aren't able to get the support they need. So there's more depression. So encouraging laughter, getting fresh air, meditating, all the things, talking to a friend, reaching out to a neighbor or someone who may be isolated is all therapeutic and can help with ministering to those who need it.
Yes, thank you, Dr. Jocelyn, for that reminder. I want to leave with everyone on a high note. I mean, we're talking about coronavirus. We're talking about this is a marathon. This virus is going to be with us for the foreseeable future, and our lives are going to be different for a while. But there are some things that you can do to help decrease the risk. We've talked about it today. It's important to wash your hands. That's probably first and foremost. Everywhere you go, make sure you're washing your hands or you're using hand sanitizer. That's important. That's something that you can do to help decrease the spread of the virus. You can also get a test. So we've talked about why you test. We've talked about that the tests have improved so that now you don't have to have them go all the way to the back of your brain. You can just come right here to the front of your nose and you can do it yourself. So there's so many places that you can get testing. Make sure that you look at the website, Alameda County Public Health Department website, or your public health department in whatever county you're in. Make sure that you get a test. If you test positive, it's important that you then self-quarantine. If you need help with a place to self-quarantine or food while you're self-quarantine, again, the public health department in your county has resources for you. Check those resources out. So hand washing, testing, face coverings. We've talked about making sure you use a face covering. All of these things have a percentage of decrease of the virus. When you compound them together, you're dramatically increasing your protection against spreading or getting the infection. So face coverings is important. Wear it anytime you're out, wherever you are. If you go out of your home, please put on a face covering. And lastly, if possible, as we are opening back up and more people are coming together and we're doing dining and outdoor dinings and people are coming back to work from working remotely from home, please try to social distance. That's something else we know. The virus, even though it's very social, it's not necessarily a flyer, right? So it doesn't fly, a lot farther than what we're saying about 6 feet. Correct me if I'm wrong, Dr. Jocelyn, but it's about 6 feet. So that means if you are separated from the next person and you're washing your hands, have gotten tested, you're wearing a mask, and you're social distancing while you are dramatically decreasing your risk of being infected with the virus. All of these things work together. And as we're during this time, please do take care of yourself, take care of your families, love one another, call, check on each other, text each other, FaceTime one another. So many different platforms to FaceTime. You can Zoom, you can Google Meet, Hangout, the House Party. My daughter and her friends love House Party. So many different ways, but it's important that we take care of ourselves. We always talk about generational wealth. We always talk about how it's so important that we leave something to the next generation. We leave money, we leave property. But what we don't talk about enough is generational health. And the health that the way you live your life today passes down into generation. And that is what Tammie was talking about with the structural, systematic racism, right, that we have been dealing with as Black and brown people in this country has impacted our health generationally. That has put us at a higher risk for diseases like this today. So I want you to start breaking that generational curse of bad health. We don't need to be the highest in heart disease, the highest in high blood pressure, the highest in cancer. Let's work what we can do to make sure our bodies are healthy so that we can stop this generational health crisis that we are in. So please do take care of yourself. Thank you so much, Dr. Jocelyn and Tammie, for joining, talking with Dr. Donna. Thank each and every one of you out there who is watching. And I hope that you learned something. And if you have any questions, please leave them in the comment section. I promise I will shoot them to Dr. Jocelyn or to Tammie and get them answered for you. And we are here as a resource for you. Talking with Dr. Donna, I'll be on weekly to bring you more information and resources and knowledge so you can live a healthy, mentally, physically, and spiritually healthy life. All right. Thank you, everyone. Take care until we see each other again. Be blessed. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.